Okay, so today's topic is very important, and anybody who is working in the intensive care unit or emergency department should know about it. It doesn't matter whether you are a nursing staff or a paramedics, or it's your first day of residency in the ICU or emergency, or you are already working in it. It will be a brush up sort of thing. But the topic is how to examine the brainstem function via the cranial nerves in a comatose patients. And when I'm saying about comatose patient, usually such patients are on ventilator. And now you need to examine the brainstem functions. Now, many of you are already doing it, like you are examining the pupillary reactions, doing doll's eye, checking the gag reflex or cough reflex, all such things you are doing. But the problem which I see in the students or the doctors or the nurses, those who are working or doing all those things, they do it correctly, but they don't know that which part of the brainstem they are testing. What are the cranial nerves involved in those reflexes? So if I go to explain the cranial nerves pathways and the brainstem structure, it will be a whole 8-9 hours long video. So that's not the purpose of this video. What I'm trying to explain is when you check a particular reflex in a comatose patient to examine the brainstem reflex, you need to know which part of the brainstem you are testing and what reflex carries what significance. And I assure you that by the end of this video, which is going to be somewhere around 7-8 minutes video, if you spare and pay attention carefully, you will be very confident in testing all these reflexes, and you will be very confident in telling that which part of the brainstem I have tested and whether it's injured there or whether it's functioning or not functioning, and you will be more systematic in your approach from now on. And I request that at the end of this video, do post in the comments whether you like this talking sort of teaching, or you still needs a PPT sort of lecture. And if you want a detailed session on these cranial nerves and brainstem function, you can also request in the comment section. But for next 5-6 minutes, we'll focus very crisply to the point that how to know about the brainstem function via the cranial nerves. So I have divided this video into two parts. In the first section, what we'll do is we'll list out what are the cranial nerves, what are the brainstem parts, and which cranial nerves we are testing where. And in the second part, we'll check the reflexes, and from reflexes we'll go to the brainstem, that what we have tested. So that's the structure of this video. Don't miss the first part because it is very important. So let's talk about the cranial nerves. So we have 12 pairs of cranial nerves. So to list them as a revision, first is the olfactory nerves. So olfactions, everybody know. Second is the optic nerve, which takes sensations from the signals from the optic nerve at the back of the retina. Third is your oculomotor nerve, which has a motor component also, the extraocular muscles, and as a parasympathetic functions also, which constricts the pupils. Fourth is your trochlear, which again supplies to the extraocular muscles of the eye, superior oblique. Fifth is your biggest cranial nerve, which is a trigeminal nerve, the sensations from the face and the motor supply to the muscles of mastications. Sixth is your abducens nerves, again to the extraocular muscles, which is lateral rectus. Then you have seventh, which is facial nerve, muscles of the face, sensations from the face. Eighth is vestibulocochlear, vestibules balancing, and cochlear means hearing. So eighth is your vestibulocochlear. Ninth is your glossopharyngeal, from the tongue and the pharynx. 10th is your vagus. Vagus is very large in distribution to the this all pharynx and this trachea and other parts of the abdomen and thorax and heart. Then you have spinal accessory, sternocleidomastoid, and the trapezius, and then you have hypoglossal, 12th nerve, which is the muscles of the tongue. So these are the 12 pairs of cranial nerves. I have not mentioned what is the motor part, what is the sensory part, parasympathetic, sympathetic. No, we are not interested in that. We are just interested, these are the 12 nerves, and in a comatose patients, what we are going to test. So only 8 we are going to test. 8 we are going, it doesn't mean we are able to test only 8 nerves. So we'll see that. Now these are the 12 pairs of cranial nerves. Now what do you mean by brainstem? So brainstem consists of 3 parts: midbrain, pons and medulla. So midbrain, pons and medulla. So these are the three parts, three structures which form the brainstem, and these cranial nerves originate from the brainstem as a 12 pairs. So which cranial nerve is going where? By that we'll know that which part of the brainstem we have tested. So as a simple rule is, you have midbrain, pons and medulla. So from pons there are 4, above the pons there are 4, and below the pons there are 4. So from above the pons we start with 1, 2, 3, 4. So technically olfactory and optic are not nerves, they are extensions of the brain. But for our simple understanding, we'll consider that as nerve. So above the pons means midbrain, 1, 2, 3, 4. For the simplicity, you remember that 1, 2, 3, 4 are coming from midbrain, though olfactory is not a part of it. Olfactory nerve is not from midbrain, but just for the simplicity, we'll see that. Anyway, we are not going to test it. So midbrain 1, 2, 3, 4, pons 5, 6, 7, 8, medulla 9, 10, 11, 12. Understand? So midbrain 4, pons means midbrain 1 to 4, pons 5, 6, 7, 8, and medulla 9, 10, 11, 12. So this is the structure. So now we'll see that how the reflexes are working, what are the reflexes we are testing, and how this is being mapped. So we'll start from first nerve. So olfactory nerves, anyway, we are not going to test, because a comatose patient, how can he or she say that this the olfaction is like what is the smell? So olfaction is not a part of your comatose patient testing. When I'm telling you the comatose patient, essentially I'm saying that this patient is on ventilator, cannot communicate, he is comatose, and now you are testing the brainstem reflexes. This becomes very useful in when you are testing for brain dead patients also, or when you are doing before the apnea, you are checking the brainstem reflexes. So this becomes very useful in that case also. So olfaction we are not testing. Now comes the first reflex we will check is pupillary reaction to light. We'll check the pupil reaction. So normally what we do, you bring a torch towards the pupils and the pupil should constrict by the light. So what is happening here? When you are bringing the light to the eye, the pupils, the light is going inside on the retina. The second nerve is taking that signal to the midbrain in the pretectal nucleus. Don't get confused about the nucleus part. We are just enumerating where it is going. So second nerve is taking the signal from the retina. It is going in the midbrain pretectal nucleus. Then it is going in the third nerve parasympathetic nucleus, which is Edinger-Westphal nucleus. So EW nucleus. And the third nerve is carrying via parasympathetic fibers to the pupillary sphincter. So the pupil constrict. So what you have done is afferent pathway, means the pathway which has taken the light is via the optic nerve, and the third nerve had carried backward and constricted the pupil. So the third nerve. So you have tested in a pupillary light reflex, you have tested the second and the third nerve. So what you have tested, we know that the second, third and fourth is a part of midbrain. So you have tested midbrain. So just by a pupillary light reflex, you have tested the second and third nerve, essentially testing the midbrain. Anyway, there can be an injury in the whole pathway, but what you should know that by the light reflex, by the pupillary light reflex, you have tested the second and third nerve, which is essentially tested the midbrain. Now, after that, what will you do? You will do the corneal reflex. So you will bring a cotton sort of soft touch on the cornea, and the eye should blink. Something like that should happen. So what you are testing? When you tested the cornea, the fifth nerve, your trigeminal nerve, has taken the sensation and is taken to back in the nucleus, where the fifth nerve is in the pons. In the pons, now it gives signal to the seventh nerve, and then your orbicularis oculi muscle contracts and your eyes should close down. So in corneal reflex, you have tested the fifth nerve and the seventh nerve. The fifth and seventh are both a part of pons. We remember now, 5, 6, 7, 8. So we have tested the pons by the corneal reflex. So two reflexes we have taken. Pupillary right reflexes we have tested second and third. Via the we tested midbrain. We have corneal reflex, we have tested fifth and seventh, and we have tested the pons. Now what we'll do, third is doll's eye. You will move the head towards one side and eye should come like this. So doll's eye phenomena. So in doll's eye, what we are doing is in the vestibulocochlear via the nerve. Cochlear is for hearing and vestibule component is through the semicircular canals. So we have stimulated the semicircular canals. So eighth nerve carries the signals in the pons, and there are two pathways: parapontine reticular formation (PPRF) and medial longitudinal fascicle. So PPRF goes through the sixth nerve, which is your abducens, lateral rectus, and medial longitudinal fascicle goes through to the third nerve. So they move the eyes to the midline. So you have tested eighth nerve via the vestibule component, then it goes to the third and sixth nerve. So because sixth and eighth are part of the pons, you have tested that, and the third is still a part of midbrain, so you have tested pons and midbrain. So in doll's eye you have tested the eighth nerve vestibule component and the sixth and the third nerve. Fourth nerve is not tested. So we have tested the pons, majority pons, and a part of the midbrain, so doll's eye. At times there is a cervical spine injury or you are not able to elicit the doll's eye. So what you do is cold calorie test. So you put 50 cc of cold calorie in this and then wait for certain amount of time and you see the eye movements where it is going. So cold calorie test is same as oculocephalic. Earlier doll's eye is called as oculocephalic, oculo and cephalic. This is oculovestibular cold calorie test. So we stimulate the vestibule. Again the same phenomena. Again it goes in the pons and then to the both the pathways. One is going to the sixth nerve and one is going to third nerve. So again you have tested the pons and again you have tested via sixth nerve the pons and via third the midbrain. So oculocephalic and oculocephalic and oculovestibular both are testing the pons and a portion of the midbrain. Correct? Now medulla. Now we have tested. We have till now what we have tested. Olfactory we have not tested. Through pupillary right reflex, optic and oculomotor, parasympathetic. So we have tested the second and third midbrain portion. Then the through the corneal reflex we have tested the fifth nerve and the seventh nerve, which is a part of the pons. Then we have tested oculocephalic, eighth, and then sixth and third. So pons and a part of midbrain because of the third nerve. Oculovestibular again pons and a part of pons and midbrain. Now comes your gag reflex. You stimulate the posterior pharyngeal wall and then you check. So posterior pharyngeal wall and you look for the contractions of the muscles. So posterior pharyngeal wall is stimulated by the ninth nerve, which is glossopharyngeal, pharynx, and then it is taken into the nucleus and then the signal comes to the vagus nerve, which is a 10th. So you have tested 9th and 10th. 9th and 10th are part of, you understand, midbrain, pons, medulla. So medulla is 9, 10, 11, 12th. So you have tested the medullary component. Now, so gag reflex, and then when the patient is on ventilator, you put a suction catheter and then you touch the carina and still the patient, you are testing the cough of the patient. So this cough is stimulated by the 10th. So you are testing the 10th nerve. So again the medulla. So what all nerves we have tested till now? We have tested olfactory, we have not tested. We have tested the optic nerve, oculomotor nerve. Fourth we have not tested. Fifth trigeminal we have tested. Sixth we have tested. Seventh we have tested. Eighth we have tested. Ninth we have tested. And 10th we have tested. And 11th, 12th will not be tested. So out of 12 we are only able to test the 8 cranial nerves. And we have tested midbrain, pons and medulla. So this is the way we check for the all the cranial nerves and via them the functions of the brainstem. So you need to know that which cranial nerve is taking signal where and which part of the brainstem we are checking. For your better understanding, I'll show you snippet of one book. please give a 1 or 2 minute attention on that also. So this is what I was telling you about. So brainstem reflexes and the pathways tested. So pupillary light reflex. So what we are testing is cranial nerve 2 and the cranial nerve 3. Via the cranial nerve 2, it reaches to pretectal nucleus and reaches to EW Edinger-Westphal nucleus in the midbrain, and through the parasympathetic innervation via the third nerve, it constricts the eyes. So pupillary light reflex is testing the cranial nerve 2 and cranial nerve 3, and essentially we are testing the midbrain. Then corneal reflex. Via the cranial nerve 5, it is taking the sensory signal, and via the cranial nerve 7, it is bringing the signal back and blinking the eye. So we are testing the pons, because both these nuclei are located at the pons. So corneal reflex is testing the pons. Oculocephalic reflex and oculovestibular reflex. The pathway is same for both of them. Via the 8th nerve, when we stimulate either one movement of the head or via the cold calorie test, via the 8th nerve, you can see here, they take signal through parapontine reticular formation and the median longitudinal fascicle to the cranial nerve 6 and cranial nerve 3. So because 8 and 6 are located in the pons, we have tested the pons, and third is located in the midbrain, so we have tested the midbrains. So oculocephalic reflex and oculovestibular reflex both are testing the same nerves. 8, 3 and 6. 6 and 8 are located in the pons, and third is in the midbrain. So these are two are testing the pons and a portion of the midbrain. Gag reflex. It is taken, sensory portion is taken by the 9th, and motor function is taken by the 10th. So it is testing the medulla, because both of them are testing in they are in the medulla. So gag reflex is checked by the cranial nerve 9 and 10, and we are testing the medulla. Cough reflex is only by the 10 now. Both the sensation and cough is mediated by the cough reflex, and because the various nerves are involved, so majority we have tested the medulla. Some portion is in the pons, but essentially cough reflex is testing the medullary component of it. So it is, so pupillary light reflex second and third, corneal reflex 5 and 7, oculocephalic and oculovestibular 8th, 6th and 3rd, gag 9, 10 and cough 10. So now you know that how to check the brainstem function by the cranial nerves via the different reflexes. So now read about this in detail. Share and discuss with your colleague or somebody who is working with you, your junior staff or your friend. They will really thank you for this. And then test on the patients who are there in the ICU on the ventilator these reflexes. And if you still want the detailed pathway of all the cranial nerves examinations in comatose patients, do post me in the comment. And again, a request, please post me in the comment that whether you like this talking type of teaching you still need, or you still need this PPT sort of lecturing. So thank you. Do read more about it, and do discuss and teach and share with your colleagues and your staff. Thank you.